In patients who have what we describe as chronic pain syndrome, when initial surgical procedures, for whatever reason, were not helpful in completely relieving pain. In such patients who are in dire need of getting their pain under control are usually not responding to medications or injections. A procedure, what is called spinal cord stimulation, is sometimes very helpful in getting control of those chronic pains. The procedure is done by inserting a wire between the laminae, which is the space between the bones, and under X-ray, one could guide this wire in a location where maximum stimulation can be experienced by the patient. The wire, when it comes out of the skin, is attached to a battery. Patients go home with that battery attached to them for approximately 5 to 7 days, and they keep a notebook about how well their pain is controlled over a period of 5 to 7 days. When the experience of pain control is satisfactory, which means at least 50% or more improvement is experienced, then those patients can be considered as good candidates for permanent implantation. During permanent implantation, generator or the battery is implanted underneath the skin, while the actual wire, or what we describe as paddle, is inserted underneath the bone right at the space where the stimulation was maximum. Patients are asleep during the final implantation surgery, but they are awake during the trial period of spinal cord stimulation. The reason they have to be awake is because during the trial, I have to communicate with the patients about whether or not they are actually getting the stimulation that is desirable. And in order to be able to communicate, this trial procedure is done under local anesthesia. Once the location of the maximum stimulation is confirmed, then permanent stimulation does not require patients to be awake. You can put them under general anesthesia or at least sedation so that permanent placement is not that painful. One may ask, how often does the spinal cord stimulation work? Answer to that is, it doesn't work in every single patient. But the trial that is performed is the one that tells you whether or not you become a candidate for permanent stimulation. No other operation gives you a choice to try it out first to find out if it is successful. And that's why spinal cord stimulation gives you an alternative way of controlling your pain and actually trying it out before it becomes permanent.